Question 1. Which client condition requires the nurse's immediate attention? A. Client with a BP of 148/86 mmHg. B. Client reporting increased shortness of breath. C. Client with a glucose level of 160 milligrams per deciliter. D. Client requesting assistance with meals. Answer. B. Client reporting increased shortness of breath. Question 2. Which of the following tasks is appropriate for a UAP? A. Teaching proper cane use. B. Monitoring for post-op complications. C. Helping a stable client with toileting. D. Administering a fleet enema. Answer. C. Helping a stable client with toileting. Question 3. Which client can be assigned to an LPN? A. Client newly diagnosed with heart failure. B. Client with unstable blood pressure. C. Client requiring routine tray care. D. Client experiencing chest pain. Answer. C. Client requiring routine tray care. Question 4. The nurse receives the following reports. Who should be assessed first? A. Client with nausea and vomiting. B. Client who needs help ambulating. C. Client with a blood glucose of 42 milligrams per deciliter. D. Client due for wound dressing change. Answer. C. Client with a blood glucose of 42 milligrams per deciliter. Question 5. Which action by the nurse ensures safe delegation? A. Assigning tasks without giving instructions. B. Reviewing the competency of the delegatee. C. Assuming all team members are qualified. D. Delegating medication administration to UAP. Answer. B. Reviewing the competency of the delegatee. Question 6. The nurse delegates ambulation to a UAP. What should the nurse do next? A. Document the task as complete. B. Provide detailed instructions and expected outcomes. C. Ask the LPN to supervise instead. D. Allow the UAP to determine how to proceed. Answer. B. Provide detailed instructions and expected outcomes. Question 7. Which task should not be assigned to a UAP? A. Feeding a stable client. B. Performing a dressing change. C. Obtaining a urine sample. D. Measuring oral intake. Answer. B. Performing a dressing change. Question 8. A client becomes unresponsive during ambulation. What is the nurse's first action? A. Call the healthcare provider. B. Assess responsiveness and initiate emergency response. C. Notify the charge nurse. D. Help the client back to bed. Answer. B. Assess responsiveness and initiate emergency response. Question 9. The UAP tells the nurse, "I forgot to turn the patient." What is the best response? A. Please make sure to do it next time. B. I'll take over that task from now on. C. Let's review the importance of repositioning together. D. That's okay. It happens. Answer. C. Let's review the importance of repositioning together. Question 10. Which of the following clients should be prioritized first? A. A client needing a Foley catheter change. B. A client complaining of new onset vision changes. C. A client who is anxious about surgery tomorrow. D. A client due for oral meds in 15 minutes. Answer. B. A client complaining of new onset vision changes. Question 11. What task is appropriate for an experienced UAP? A. Assessing for skin breakdown. B. Teaching a client how to use a walker. C. Performing passive range of motion exercises. D. Evaluating a client's nutritional intake. Answer. C. Performing passive range of motion exercises. Question 12. The nurse notices an LPN administering 4-push medication. What is the priority? A. Assume the LPN is competent. B. Immediately verify if the LPN is allowed to perform this task. C. Report the incident. D. Ignore unless the client has an adverse reaction. Answer. B. Immediately verify if the LPN is allowed to perform this task. Question 13. A client complains of dizziness and blurred vision. What is the nurse's priority? A. Offer the client fluids. B. Administer PRN antihypertensives. C. Assess the client's vital signs. D. Call the provider immediately. Answer. C. Assess the client's vital signs. Question 14. A nurse assigns 4 clients. Which assignment is safest for a UAP? A. A client with confusion who is fall risk. B. A client requiring oxygen titration. C. A client who needs to be repositioned every 2 hours. D. A client with a new tracheostomy. Answer. C. A client who needs to be repositioned every 2 hours. Question 15. Which action by the nurse violates safe delegation principles? A. Assigning care based on staff skill level. B. Asking the UAP to document intake/output. C. Asking the UAP to explain a new medication. D. Having the UAP assist with bathing. Answer. C. Asking the UAP to explain a new medication. Question 16. Which task must the RN perform? A. Performing an admission assessment. B. Assisting with toileting. C. Obtaining vital signs. D. Recording fluid intake. Answer. A. Performing an admission assessment. Question 17. A nurse delegates a task to the UAP. What confirms successful delegation? A. The task was completed on time. B. The UAP required no supervision. C. The client outcome was achieved, and the UAP reported back. D. No incident report was needed. Answer. C. The client outcome was achieved, and the UAP reported back. Question 18. Which task can the LPN safely perform? A. Administering chemotherapy. B. Teaching post-op pain management. C. Monitoring for fluids on a stable client. D. Interpreting EKG results. Answer. C. Monitoring for fluids on a stable client. Question 19. What task should not be delegated to a UAP? A. Applying anti-embolism stockings. B. Teaching range of motion techniques. C. Assisting with oral hygiene. D. Weighing a client daily. Answer. B. Teaching range of motion techniques. Question 20. The RN is caring for 4 clients. Who requires immediate assessment? A. A client with a BP of 140/90 and no complaints. B. A client with complaints of tingling fingers post-cast. C. A client requesting a sleeping pill. D. A client whose 4 is due to be changed in 30 minutes. Answer. B. A client with complaints of tingling fingers post-cast. Question 21. Which action by the UAP requires immediate intervention? A. Taking a manual BP on a stable client. B. Giving a diabetic client orange juice without checking glucose. C. Assisting with morning hygiene. D. Recording INO on the flow sheet. Answer. B. Giving a diabetic client orange juice without checking glucose. Question 22. Which client should the RN prioritize first? A. Client with a fever of 100.9 degrees Fahrenheit. B. Client reporting sharp, left-sided chest pain. C. Client awaiting discharge instructions. D. Client requesting assistance with dressing. Answer. B. Client reporting sharp, left-sided chest pain. Question 23. What is the most appropriate task to assign to the UAP? A. Assessing for signs of infection. B. Educating a patient about insulin. C. Measuring and recording output. D. Adjusting the oxygen flow rate. Answer. C. Measuring and recording output. Question 24. Which task can be safely assigned to an experienced LPN? A. Teaching self-administration of insulin. B. Evaluating a new onset of confusion. C. Reinforcing a low-sodium diet plan. D. Creating a discharge care plan. Answer. C. Reinforcing a low-sodium diet plan. Question 25. Which UAP action should prompt the RN to intervene immediately? A. Assisting a client with dentures. B. Allowing a confused client to ambulate alone. C. Taking a radial pulse. D. Helping a client change position. Answer. B. Allowing a confused client to ambulate alone. Question 26. Which patient assignment is best for the LPN? A. Client with unstable angina. B. Post-op client 2 days after hip replacement needing wound care. C. Client newly diagnosed with DKA. D. Client receiving fork chemotherapy. Answer. B. Post-op client 2 days after hip replacement needing wound care. Question 27. UAP asks for clarification on a delegated task. What should the nurse do? A. Tell them to figure it out. B. Reassign the task. C. Review the task expectations with the UAP. D. Ask another nurse to assist. Answer. C. Review the task expectations with the UAP. Question 28. What task must be completed by the RN? A. Reinforcing education on medication side effects. B. Monitoring for adverse effects of a blood transfusion. C. Measuring blood glucose. D. Applying a clean dressing to a wound. Answer. B. Monitoring for adverse effects of a blood transfusion. Question 29. The UAP reports a post-op client is pale and diaphoretic. What should the RN do first? A. Ask the UAP to check blood pressure again. B. Immediately assess the client. C. Call the physician. D. Document the report. Answer. B. Immediately assess the client. Question 30. Which situation requires the RN to intervene? A. UAP applies lotion to a client's dry legs. B. LPN monitors a stable diabetic client. C. UAP performs passive ROM for a stroke patient. D. UAP explains wound care steps to a client. Answer. D. UAP explains wound care steps to a client. Question 31. What is the best action when a UAP forgets to weigh a client? A. Report the UAP to the charge nurse. B. Remind the UAP and stress the importance of consistency. C. Reassign the task to an LPN. D. Weigh the client and ignore the lapse. Answer. B. Remind the UAP and stress the importance of consistency. Question 32. What task can be safely delegated to a UAP in a long-term care setting? A. Administering medications. B. Assessing pain level. C. Assisting with toileting and mobility. D. Interpreting blood test results. Answer. C. Assisting with toileting and mobility. Question 33. The nurse must assess a newly admitted client. Who can be delegated routine tasks? A. Another RN. B. LPN. C. UAP. D. Clinical educator. Answer. C. UAP. Question 34. Which is the nurse's first priority during shift change? A. Answering family questions. B. Reviewing the previous shift's documentation. C. Rounding on unstable clients. D. Printing the medication administration records. Answer. C. Rounding on unstable clients. Question 35. A UAP provides inaccurate intake/output records. What is the nurse's best response? A. Ask another staff member to redo the charting. B. Provide immediate feedback and retraining. C. Ignore it unless a pattern develops. D. Reassign the task permanently. Answer: B. Provide immediate feedback and retraining. Question 36. Which task is the RN required to perform? A. Collecting a stool sample. B. Conducting a comprehensive physical assessment. C. Assisting with ambulation. D. Recording daily weights. Answer: B. Conducting a comprehensive physical assessment. Question 37. The nurse observes the UAP transferring a client incorrectly. What should the nurse do first? A. Report it to administration. B. Wait until the shift ends to review. C. Stop the task and provide real-time correction. D. Assign a different UAP. Answer: C. Stop the task and provide real-time correction. Question 38. A nurse is planning assignments for the day. Which client should the RN keep for self? A. A client on contact precautions. B. A client with a new onset of confusion. C. A client requiring routine catheter care. D. A client needing a walker to ambulate. Answer: B. A client with a new onset of confusion. Question 39. Which statement about delegation is correct? A. The RN is not responsible after delegating. B. Delegation eliminates accountability. C. Delegation must match skill level and scope. D. LPNs can delegate to RNs. Answer: C. Delegation must match skill level and scope. Question 40. Who is the best team member to perform blood glucose monitoring? A. Registered nurse. B. Licensed practical nurse. C. Unlicensed assistive personnel. D. Any of the above if properly trained. Answer: D. Any of the above if properly trained. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.